ABM Respiratory Care is dedicated to advancing the standard of patient care for people suffering from chronic lung diseases and acute breathing disorders through innovative technologies. The BiWaze Clear system is part of their airway clearance portfolio of respiratory solutions. BiWaze Clear is designed to be used across the continuum of care, from hospital to home. The therapy can be delivered by healthcare providers, caregivers, and patients. BiWaze Clear provides oscillating lung expansion, or OLE therapy. This is essentially a combination of 3 airway clearance therapies: lung expansion, high-frequency oscillation, and nebulization. Let's go through each therapy in more detail. First, lung expansion therapy, used to open airways of people who are unable to take a deep breath on their own. This therapy can help keep airways from collapsing and help reopen collapsed airways. The second therapy is the high-frequency oscillation to mobilize secretions. This therapy gently shakes the airways internally to break up and thin secretions stuck in the lungs, so patients can cough it up or suction it out. If secretions are left in the lungs, they can cause an infection. The third therapy is nebulization. This therapy is used to deliver medication into the lungs. The medicine and moisture help calm airways and loosen secretions in the lungs. The BiWaze Clear system assists patients in loosening and mobilizing secretions, as well as treating and preventing atelectasis by providing lung expansion and high-frequency oscillation therapies. OLE therapy can benefit people with chronic conditions who struggle to clear retained secretions. People at risk of or have atelectasis, as well as those having difficulty in mobilizing retained secretions due to acute conditions, would benefit from OLE therapy. The BiWaze Clear system may be used with a patient interface like face mask, mouthpiece, a trach adapter to a patient's endotracheal or tracheostomy tube, or in line with a ventilator. This video will provide an overview of the benefits of the therapy system and how to use it in the home care environment. For complete instructions, refer to the BiWaze Clear System User Manual. System Overview. The BiWaze Clear system has a control unit, dual-lumen breathing circuit, power cord, and carrying bag. The dual-lumen breathing circuit is for single-patient use only. It is disposable and designed to be used for up to 90 therapy sessions or 1 month in the home care environment. The dual-lumen breathing circuit connects to the main control unit so therapy can be delivered. The nebulizer kit is designed to be used with the BiWaze Clear's dual-lumen breathing circuit and should only be used to nebulize medications prescribed by a physician. The BiWaze Clear system can be powered by a lithium-ion battery when AC power is not available. A fully charged new battery can support 10 typical therapies. The system is only 9 pounds, so it is designed to be portable and travel with you. BiWaze Clear can store up to 10 therapy profiles of a pre-programmed therapy protocol. Profiles allow people to have several therapy choices so they can quickly receive a personalized therapy when they need it. In addition, BiWaze Clear has the capability for each phase to be programmed differently, providing a tailored and comfortable therapy experience. Indications and contraindications. BiWaze Clear is indicated for mobilization of secretions, lung expansion therapy, the treatment and prevention of pulmonary atelectasis, and has the ability to provide supplemental oxygen when used with oxygen supply. BiWaze Clear can be used on adult and pediatric patients in hospital, long-term care, and home care environments. The system is indicated for but not limited to patients with difficulty in clearance of secretions and pulmonary atelectasis. BiWaze Clear has one absolute contraindication, and that is the patient condition of an untreated tension pneumothorax. How it works. The BiWaze Clear system delivers oscillating lung expansion therapy to assist in the mobilization of retained secretions, provide lung expansion therapy, and treat or prevent pulmonary atelectasis. The system delivers a combination of 3 different respiratory therapies. First is positive expiratory pressure therapy, or PEP, which provides positive expiratory pressure when a patient exhales. This therapy is intended to expand airways or reopen closed airways. Second is oscillation, or OS, which provides high-frequency oscillations during inhalation and exhalation. This is a pneumatic form of chest physiotherapy that oscillate the airways with continuous pulses of positive pressure. Third is nebulization, or neb, which provides aerosolized medication. The neb can be used during PEP and OSS or by itself. The goal of the therapy is to break up retained secretions in the airways, also to reopen and help keep open any closed airways so the patient can breathe easier with cleared airways. Control unit overview. The BiWaze Clear system includes a control unit, power cord, carrying bag, and dual lumen breathing circuit. The control unit components include a touchscreen, circuit port for connection to the dual lumen breathing circuit, an LED light to indicate different modes of therapy, and a button to start and pause therapy. A carrying handle, power on-off switch, and AC power inlet for the power cord. On the left side of the control unit, you will find ports for the Aerogen nebulizer power cable, external HDMI display port, 2 USB ports for SpO2 sensor connection to download log files or exchange device settings, and an air outlet port for expiratory air. On the right side of the control unit, you will find the replaceable air inlet filter. BiWaze Clear has an internal lithium-ion battery. A fully charged new battery can support 10 typical therapies. The internal battery can charge simultaneously while the device is plugged into a power outlet. To power the device, plug the socket end of the power cord into the AC inlet on the back of the device. Plug the pronged end into an electrical outlet. Assemble dual lumen breathing circuit. To assemble the patient circuit, attach the larger end of the coaxial tube to the end of the bacterial viral filter that has the company logo. Connect and twist the handset into the smaller end of the coaxial tube. Insert the Aerogen nebulizer to the top of the handset. Plug the larger end of the nebulizer power cable into the neb cup. Then plug the smaller end of the cable into the side of the device where the Aerogen logo is displayed. You may have to move the rubber cover to access the nebulizer power port. Attach the end of the bacterial viral filter that has the oxygen port to the patient port of the control unit. Add the prescribed medication or saline to the nebulizer and insert the plug. BiWaze Clear allows for 4 different patient interface options: a face mask, a mouthpiece, a trach adapter, and in line with a ventilator. When using a mouthpiece, insert the 22mm end of the mouthpiece onto the handset. When using the face mask, insert the 22mm end of the face mask onto the handset. When using a flexible trach tube adapter, insert the 22mm end of the trach adapter onto the handset. When using BiWaze Clear in line with a ventilator, insert the 22mm by 15mm connector onto the handset. Insert the connector into a T-adapter placed into the inspiratory limb of a ventilator circuit. Note: you should start therapy on the control unit prior to making the connection to the trach tube or in line to the ventilator to ensure there is flow to the patient. Prepare to deliver therapy. Select a location to deliver therapy that will be comfortable. Power on BiWaze Clear by using the switch on the back of the control unit. You will hear the system self-calibrate as it powers on. If the battery is low, plug the control unit into a power outlet. Ensure the location is comfortable and the person receiving therapy is in an upright position if possible. Before delivering therapy, ensure the dual lumen breathing circuit is assembled. If using a mouthpiece, ensure there is a tight seal around the mouthpiece. If using a face mask, tightly but comfortably cover the mouth and nose. Make sure the narrow end of the mask is over the patient's nose. If the patient has a tracheostomy, connect the smaller end of the flexible trach adapter to the patient's tracheal tube. When not delivering therapy, disconnect the dual lumen breathing circuit so the patient can breathe freely through their tracheal tube. Program manual mode therapy. Delivering therapy in manual mode allows the respiratory therapist or caregiver to adjust therapy real-time based on the patient feedback. To program manual mode therapy, press Manual Mode from the top menu bar. The settings for PEP, OSS, and neb are displayed in the middle circles. To adjust PEP, press on the PEP circle and adjust the pressure between 0 and 30 centimeters of water. To adjust OSS, press the OSS circle. You can adjust the pressure between 5 and 70 and the frequency between low, medium, and high. Low, 3 Hz, medium, 4 Hz, or high, 5 Hz. There are no adjustments available for the nebulizer. It is either on or off, and the pressure delivered when the nebulizer is running alone is 1 centimeter of water. If the nebulizer is running with PEP or OSS, no added pressure is delivered. Deliver manual mode therapy. Ensure you are on manual mode on the top menu bar, and the pressures on the screen match the patient's prescription. To begin manual therapy, press the Start button on the bottom of the screen. This engages the blowers and the system is ready to deliver therapy. If you are assisting with the therapy using a flexible trach adapter, it is a good idea to hold the handset so it isn't pulling on the patient's tracheostomy tube. If you are a patient receiving therapy, be sure to keep a tight seal around the mouthpiece so there aren't any leaks, and keep your cheeks in, don't let them puff out. If you are using a face mask, ensure the mouth and nose are covered by the face mask and it is pressed firmly against the face so there aren't any leaks. If you are a caregiver assisting with therapy, it is a good idea to coach the patient through the different therapy phases. The patient should breathe normally during therapy. Press PEP to deliver the therapy. You will see the time begin to increase under the PEP circle, and the PEP circle is illuminated. If you want to run the nebulizer during PEP, press NEB so the nebulizer runs during the therapy. The NEB circle is illuminated, and you can see on the screen how long the therapy has been running under the NEB circle. To turn off the NEB, press the NEB circle. You will know the NEB is off when it is no longer illuminated, and the NEB timer will stop. To adjust the oscillation settings, conduct a long press on the OS circle and you will be able to adjust the settings real-time. You can alter pressure and frequency based on the patient's feedback. If you switch back to PEP, press the circle to illuminate the therapy and you will see the timer begins. You can see the current phase time and the total phase time for PEP. Continue to alternate between PEP and OS, turning on NEB when needed. The nebulizer can also be run on its own by ensuring only NEB is illuminated. The timers below each therapy phase will adjust based upon which therapy is active. The total therapy time will be visible on the top of the screen. During the therapy, exhale slowly over 3 or 4 seconds. Also, it is good to cough out secretions as they mobilize in the upper airways. When the treatment is completed, press the pause button on the bottom of the screen. Then press End Now. The Therapy Complete ribbon will be displayed across the screen. You can see the therapy summary by pressing on the I on the right of the ribbon. To close the ribbon, press X on the left. Program Auto Mode Therapy. Auto mode therapy can be delivered from pre-programmed therapy protocols or prescriptions. Up to 10 profiles can be saved on the BiWaze Clear with personalized names. To program auto mode therapy, press Auto Mode on the top of the screen. Press the pencil button on the left of the screen to program the prescribed therapy. Press on a phase to edit the settings or to remove the phase. To edit the PEP phase, use the arrow keys to adjust the pressure and time. The pressure ranges from 0 to 30 centimeters of water. The time can be set from 5 seconds to 30 minutes. The NEB toggle turns the NEB on or off for this particular phase. The trash can icon will remove the phase. Press the check mark to save the changes to the phase. To edit an OS phase, use the arrow keys to adjust the pressure and time. The pressure ranges from 5 to 70 centimeters of water. The time can be set from 5 seconds to 30 minutes. The NEB toggle turns the NEB on or off for this particular phase. The radio buttons allow you to select the frequency of low, medium, or high oscillations. Low is 3 Hz, medium is 4 Hz, and high is 5 Hz. The trash can icon will remove this phase. Press the check mark to save the changes to the phase. New phases can be added to the therapy list by pressing on the type of phase you want to add and dragging it to the therapy list. You can also rearrange the therapies by dragging them to a new location in the therapy list. The total number of phases and therapy time is displayed on the bottom. Press the green check mark to save the therapy. The therapy can be saved as a profile by pressing the system icon on the bottom left and selecting Save Profile. Type the name of the profile with the keyboard. It can be up to 13 characters, and it will be available under Auto once you press Save. Deliver Auto Mode Therapy. Auto Mode Therapy delivers a pre-programmed therapy prescription. The therapy profile last used on the control unit is the therapy displayed on the screen. You can press Start to run this therapy or select a different therapy profile from the Auto Profile list. The system can store up to 10 pre-programmed therapy profiles. Once the correct therapy profile is selected, press the Start button. BiWaze Clear will deliver the therapy continuously until the therapy is completed. If the patient is using a face mask, ensure it is tight against their face without any leaks of air. If you are using a mouthpiece, make a tight seal around the mouthpiece and keep your cheeks in. Don't let your cheeks puff out. If using a flexible trach tube adapter, hold the handset during therapy so there isn't additional pressure on the patient's tracheostomy. In auto mode, the device will go through the entire programmed therapy and will display the current phase being delivered and the upcoming phase. The therapy time on the top will allow you to track how much time you have left. The therapy can be paused at any time by pressing on the pause button on the bottom of the screen. A timer will appear on the screen to show how long the device has been paused. The device will automatically end therapy after 5 minutes of being paused. You can either resume therapy or end the therapy from this screen. After the therapy is finished, a Therapy Complete ribbon will be displayed across the screen. You can see the details of the therapy summary by pressing I on the right of the ribbon. To close the ribbon, press X on the top left. Cleaning and maintenance. Before cleaning, be sure to power off the device. Disconnect the dual lumen breathing circuit from the device and unplug the power cord if plugged in, and disconnect the dual lumen breathing circuit, including the Aerogen power cable. Wipe the control unit and Aerogen power cable with a cleaning towelette or damp cloth. Do not spray water or cleaner onto the control unit. Allow all parts to dry completely before reconnecting them for use. The viral bacteria filter and Aerogen Solo nebulizer cannot be washed. Examine the inside of the filter, and if it is visibly wet or soiled, replace it. The outer plastic may be wiped with a cleaning towelette. Disconnect the remaining circuit components. Thoroughly wash in mild detergent and warm water. Rinse all soap from the components and place the small parts on a lint-free towel and hang the coaxial breathing tube to dry. Ensure all the components of the dual lumen breathing circuit are dry before reuse. For complete cleaning instructions, including compatible cleaning detergents, refer to the BiWaze Clear System User Manual. Closing. The BiWaze Clear combines hygiene, efficiency, and personalization into a unique therapy experience. The 3 therapies in one small, portable, battery-operated device gives you the opportunity to live life on your terms. For more information about the BiWaze Clear system, visit our website at www.abmrc.com.